The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Notice that for the least severe cases, we used to refer to that as Asperger's, but I need to remind you that this disorder currently falls within the same family and category of the DSM. Notice that this disorder is generally manifested in childhood. And what is the main characteristic of autism? Well, the main characteristic of autism is social impairments, right? A difficulty of having common, typical, socially acceptable interactions and communication. Notice that because of that reason, there is a severely restricted interest, right? So we also see that the person may only like the one thing. So they become interested in the one thing. So instead of having a wide variety of aspects that can make them social, so for example, they like playing pool, they like playing video games, they like drawing. Notice that the person may now only play video games, and that is the only aspect of interest and activities that that person would do instead of having a wide variety of interests. Usually, these social limits with interactions manifest themselves usually around the age of 3. So we start noticing that the individual does not behave in a social interaction manner around the age of 3. Right now, the youngest client that we have in our practice is 18 months. The oldest client that we have is 82. So notice that it is a wide range between all of us. We do see individuals who are very young. What are the symptoms? What are the characteristics, I should say, that are prevalent with individuals who have autism? Notice, remember that we have an impairment for social interaction. So it is expected that a person with autism lacks of interest in other people. They do lack an interest in other people. Notice that their verbal communication may become impaired, either very severely to the point that they are nonverbal, or to the least impairment sense. So for example, they're able to hold a conversation, but the problem is that the social cues and interactions of that conversation are not adequate. Right? So for example, it's something that is pretty typical is, for example, if I ask an average person, hey, how you doing? How's your family? Say, oh, I'm doing well. You know, my dad got a promotion or my mom got fired, and so it's not going that well. Whereas if I ask the same person with the same questions to the person who has autism, I say, hey, how you doing? How's your family? They're doing okay. So notice that the social aspect of the conversation, of communication, may be impaired. Notice that there is a significant preoccupation to repetitive body movements. So for example, the person may start having a specific movement. So for example, a lot of them shake their hands. A lot of them may have a tic. A lot of individuals may have some sort of tapping, some sort of habitual ritualistic movement that provides some sort of comfort most of the time. They also have extreme inflexibility. And what do I mean by that? I mean that change is immensely distressful, if not almost borderline traumatic. So for instance, if I were to say to you, we're going to move from in-person to completely online. The average person will say, oh man, that sucks. I like being in person. I'm more engaged, like I pay attention. Some of you would be like, oh man, that's great. You know, I don't spend money on gas. Whereas someone who's autistic, this may be a big change. This may be very distressful because this is something that they were not expecting, I should say. Notice that because we have more understanding of what this neuropsychological disorder is, we have increased in the sense of diagnosis. A lot of people say, well, back in my day, we didn't have autism. Well, that's because we didn't have enough research. Just like there was a point where we didn't have HIV. We didn't have information about the disorder. At some point, we didn't have corona. Back in my day, people didn't have corona. Well, of course they did it, because we don't have that type of research. But notice that a lot of people do make that argument, but now we have more science to understand what autism is. Notice that the vast majority, about 80% of the persons who suffer from autism are males. Yes, sir.
I had a lot of friends that who were autistic, and they were all like far smarter than everyone else. Is that something to do with it, or is that just?
To my understanding, I wouldn't necessarily be able to answer that question. A lot of people, I can answer, however, a lot of people confuse autism with learning disability, and they're not inclusive. Just because a person is autistic doesn't mean that they have a learning disability, but just because a person is autistic, it doesn't mean that they're going to be intellectually gifted, right? The problem is that I feel like people associate autism with a learning disability. And this is not about a learning disability. This is about social interactions, the difficulty that a person, the inflexibility that they may have with social interactions. Now, it is more rare to see autism in females in regards to the prevalence of the disorder. It is generally more typical in males. Notice that there are some aspects about etiology that I would like to talk to you about. Notice that one of the main contributors for autism spectrum disorder is genetics. Notice that generally we have found a relationship, right? A correlation, meaning not causation, a link between a generally larger brain, which is noticeable by the age of 2, right? So that's one of the features that we could expect. Why is it? Well, it's generally more enlarged because we have 67% more of neurons in their prefrontal cortex, right? So they generally do have more neurons. Because of that overgrowth, right? If I have too many connections, now we're going to have some disruption in the neural circuits. So I want you to imagine a highway, right? We can only have so many exits and so many paths in a highway before it becomes very confusing, and then we start having car accidents. The same is here, right? Same happens here. We have so many overgrowth of neurons. There's too many pathways. And now it's really difficult to have a clear neural path, a clear neural circuit. Notice that just like schizophrenia, we are still having issues in identifying the etiology of autism. Notice that a lot of individuals, because of that reason, because we don't have an etiology clearly defined, a lot of people would like to attribute autism to vaccines. That has been repeatedly rejected by research, repeatedly rejected. The etiology of autism has not been found to be linked or caused by vaccinations. We don't have any evidence to support that. Let's talk about personality disorders, which is perhaps one of my favorites. Personality disorders. Notice that personality, as we defined previously in other lectures, we talked about personality as being a consistent pattern, right? Personality is a consistent pattern of behavior that I can expect from you, right? That you are going to use to inform your behavior. So for example, if you're extroverted, I can expect and predict that if you go to a party, you're going to be sociable. If you are introverted, I can expect that if you go to a party or social gathering, maybe a little bit more reserved. But notice that personality can be impaired by mental illness. How does that happen? Well, that happens through personality disorders. Notice that personality disorders are marked generally because of an extreme inflexible trait. Simply, you become maladaptive. Notice that because you are inflexible, when you have a personality disorder, it's going to cause distress. It's going to cause distress And it could come in the form of social or occupational functioning. Generally, a personality disorder becomes more apparent or recognizable in adolescence or early adulthood. Now, there are three specific clusters, three specific categories that we will discuss when it comes to personality disorders. The first cluster is anxious or fearful. The second cluster is odd and eccentric. And the last one is dramatic and impulsive. Some of you might have used the term antisocial before, and I want to tell you right now, please forget about everything you know about antisocial, because chances are that what you've learned is incorrect. So today we're going to talk about the actual correct definition of antisocial. Antisocial doesn't mean reserved, right? Antisocial, I'm just super antisocial. I don't want to hang out with these people. That is absolutely not what it means. Antisocial personality disorder is characterized by being impulsive. It's characterized by being aggressive and irresponsible. Notice that it's also characterized by being manipulative with other individuals. Notice that generally, these are individuals who tend to be very callous. So basically, I'm going to get mine because I'm going to get mine no matter what. That is what an antisocial person is, okay? I'm going to get mine because I'm going to get mine. I'm going to do my own. So if I have to engage in a responsible behavior to do so, if I have to hurt somebody's feelings along the way, well, so be it. That is one of the characteristics of antisocial personality disorder. This one, you might have heard before, might have heard about borderline personality disorder. Borderline personality disorder, and let me put a little caveat here, personality disorders are immensely difficult to treat, very difficult to treat. I put them up in the category with schizophrenia, very difficult to treat. And why is that? Well, you have your personality 24/7, right? You're you all the time, right? You're you all the time. So if you're you all the time, and this is how you have adapted, right? Because remember, personality helps you adapt to your surroundings and how you're going to behave. How am I to change that? But this is who you are, right? So notice that they are very difficult to treat. Borderline personality disorder is characterized, if you take nothing else on borderline, is instability. Persons who are borderline is actually not a common disorder. We only have 2 people right now in the practice who have been diagnosed by borderline, and my boss has both of them. It's characterized by instability, particularly in social relationships. I hate you, but come love me though. I hate you so much. You're worthless, but I love you though. Come here. I love you so much. Might have seen people who are like that. Notice that their sense of self-image is immensely low, immensely low. I argue that their sense of self-image is only as good as the relationships they want to have. So for example, they'll invest themselves so much in a relationship. And if they see that the other person is not 1,000% invested, you're worthless. I hate you. You don't appreciate me. But in reality, a person doesn't have to be 1,000% invested, do they? They really don't. So it's an unrealistic expectation. If you see this in practice, you'll see you are my therapist. You're supposed to answer this question when I call you, when I email you, because you are my therapist and I am hurt. I am your therapist, but I have a scheduled hour in which I'm going to see you. So notice that their social relationships, instead of having a healthy relationship with their therapist, it becomes very overbearing, right? It's very difficult to treat and it's very difficult to practice with someone who has borderline personality disorder. You will be in a session for 55 minutes talking about, say, they have problems at the school, and the last 5 minutes, they know that this relationship is about to end, right? This hour of therapy is about to end. But because they have that necessity of pulling you in, 5 minutes before the session's over, I want to kill myself. You just spent a whole hour talking about your issues at school. We could have spent a whole hour talking about your suicidal ideation, so we reduce those chances, right? But notice that that is done because of impaired emotional functioning. Very difficult to treat. Generally, women are diagnosed with this disorder more frequently. I argue that it's not because women have that disorder more, it's because men tend to get like misdiagnosed. So instead of diagnosing a male with borderline, they'll diagnose him with antisocial personality disorder, when in reality, perhaps a borderline diagnosis would have been better. Let's talk about narcissistic personality disorder. Narcissistic personality disorder is characterized by a high marked sense of grandiosity. There is a high sense of importance. There is a high sense of entitlement. Notice that because of that, because they are highly entitled, these individuals may have a severe need for attention, to the point where they consider themselves to be superior. The reality is that it's the complete opposite. They consider themselves to be worthless. And therefore, we have to make up that sense of worthlessness by considering ourselves super immensely superior. Now, what exactly leads to personality disorders? We do have evidence to demonstrate genetic predisposition and environmental factors. One of the ones that I like to think a lot is about coping. Let's talk about cognitive styles. The way the person thinks, the way the person copes, and how much stress this person has experienced. Notice that we know that hereditary factors can indeed contribute to personality disorders. Notice that studies with twin and family research do support that there is an influence in hereditary factors. One of the main reasons that people suffer from personality disorders is because they have learned to cope in an incorrect way. So notice that a lot of the individuals who suffer from borderline have been sexually assaulted or have a history of being sexually assaulted at some point. So because I don't know how to cope with a relationship, notice that now I love to hate you. So there is a lot of aspects of not knowing how to cope. I am narcissistic because I haven't learned how to cope with the fact that I have a poor self-image and self-worth. So because I haven't learned how to cope with that, I'm going to do the complete opposite. Look how grandiose and awesome I am. The world owns me. Stop it. Any questions about that?